So let me start with the basic contents for today. So I would be starting with exoskeleton overviews, as the previous speaker also spoke. I would talk into little clinical considerations for these exoskeletons, safety factors that has to be considered, the basic technologies, and the human interface, and any other considerations that should be given into the system for taking into designing system. So, as a designer, when you see an exoskeleton, why I put a beetle is basically this is an arthropod which has a very hard element to support its inner structure. So these were basically, inspirations for system design. So what we do is, these kind of systems is what we try to duplicate. So in this context, specific to spinal cord injury, so we have a human who's actually who has zero power in his lower limbs. And also, there is an endoskeleton, which means that it's a skeleton within the system, and then you have an exoskeleton covering this soft tissue. So there's two different considerations. One is giving power to the system, to the joint, and giving a structural integrity to these systems. So power is delivered either by an electrical activated system, or it can be passively activated system. And then when you structurally give some kind of strength to these platforms, you have a rigid element in the picture. So this is what would probably make you develop an exoskeleton. But in general, these are basic, natural systems that you try to mimic. So this is just an example. And by definition, these are robotic systems that can augment or support a human capability. And in terms of, it just enhances a physical capability. It can give you extra, strength in general, and it will give you power efficiency in terms of endurance and mobility. So exoskeleton in general, where basically, it started with the military applications, and then further it has gone down to the medical applications. So this is the definition purpose of the systems. And when I come to the, very specific to types of exoskeletons that I would probably put into, we can probably say there is 4 different types, which are probably, break down into a little more. One is unpowered weight bearing systems, which are complete systems. And the second systems is, when you target a specific joint, which are basically unpowered. When I say unpowered, there is no external energy that is given to the system. So it can be a spring, it can be a gas spring kind of an entity, where it stores energy and it can return back the energy. But in general, it cannot produce, it is not power driven. So the third type is clinically weight bearing systems. These are powered active devices, which are generally slightly bulky in nature, which supports a complete integral component of your body. This is the third type of devices. And the fourth is, again, a powered exoskeleton, which is targeted to a very specific point of your joint. So it can be a hip, it can be an ankle, or it can any part of your upper body. So these are 4 basic considerations, types of exoskeletons that we can primarily talk to. And let me break the third segment, clinical weight bearing systems. I would like to break it into 3 more components. So these are 3 as overground weight systems. These are like systems where a patient is held overground through a harness, and then they are made to walk in a treadmill. So this is overground weight bearing systems. Standalone systems are basically in exoskeletons which can walk as a mobile, will help them move, and this basically needs some kind of upper body strength or structural integrity for them to walk alone. So that would be the second systems. And the third system that I would like to talk and primarily we work on is hybrid systems, where it will have more both advantages and disadvantages of the first and two systems. So these are systems that it's called Cybulum that we have designed. So this is what we work on primarily. So these are systems which has advantages from both the overground system and a standalone system. So a standalone system, though it looks like it has a lot of advantages, what happens is there is chances of failure. And it takes nearly 2 weeks for a patient to train in such a system to get into and to start working. So that we started with designing such systems, but we when we started to feel that the training time to was a little longer, so we wanted to reduce the system. So right now the design system will have a complete support system, so that primarily reduces the training time of an individual. Say, within an hour, a patient can start walking. In comparison to standalone system, you need to train a patient for nearly 2.5 weeks in-house. So this system will take you another other advantages. Basically, these systems are mobile in nature, which means you can walk along a hallway or within your home or such kind of an activity, and it's also fail safe. So these are the systems that we design here, and Cybolymp is our device that we design. And the other advantage is basically these are AI devices, AI driven systems where it can recognize an activity and start a gate initialization. So which means that the impedance or the resistance to a device is little less, because it's just a very natural way of communicating with the device, human machine interface. So these are AI design systems.
2 minutes left.
And applications in general,
Hello.
these are used in
Excuse
assistive
me.
technologies.
2 minutes left now.
Sorry,
2 minutes left. 2 minutes. You have to conclude.
sir,
You have to conclude in
was there
two
any
minutes.
question?
You have to conclude in two
Just,
minutes.
yeah, sorry.
Uh, I'm not able to hear you. Is that question?
No, it's okay. Just if you can finish in 2 minutes, please.
Yeah, sure. Okay, yeah. Okay, yeah. So, let me quickly get into the considerations. Exclusions, but not limited to, is something that, as I spoke earlier, you have a bone structure and a soft tissue. So these two considerations are basic, important consideration for design of a system. So we take into the consideration of a bone density, and then how soft tissues are handled. So, you see a patient with T60, 78 complete spinal cord injury that we have been testing with, and the other patient is a T12 complete injury. And, in terms of ergonomics, you need a proper fit and minimize fatigue for the patient. And the weight distribution has to be even in nature. And you're looking for a mobility and dexterity, and very natural movement in the sense. Safety aspects, as I that would be an important criterion, because that's what we are looking for, to identify any kind of hazards that a patient would probably incur during the training, and evaluate the severity and implement strategic procedures for corrections. And it should convey with compliance for regulations and user trail and risk assessment. So what I would probably end up with saying that it needs a complete system or an ecosystem to divide to have a spinal cord injured patient, and a proper process to put in an exoskeleton. You can't generally, it's very difficult to put in a patient straight away. There should be an ecosystem and a process associated putting in a patient. And technology, there is sensor fusion, there is precision actuation, which are very important factors in the control system. So So let me close down my speech on this. Another consideration that you would like to take into is maintenance of the system. So there's two different considerations. One is space availability for your hospitals and your maintenance cost. So these are two considerations that you need to give. And and thank you so much for this opportunity.